We begin with that more contagious strain of COVID-19 showing up for the first time in Waukesha County.
It's only Wisconsin's second case. The other was diagnosed in Eau Claire County on the other side of the state.
The scientists in charge of tracking COVID tell our Tom Durian there is likely more out there that's going undetected.
The viral genome has 30,000 letters in it. And what that means is that every time the virus infects a couple people, there's a new letter put into that virus.
Inside a University of Wisconsin-Madison lab, researchers Shelby O'Connor and others study viruses and their mutations, also known as sequencing.
We just need to know what is circulating around us so that we can be as well prepared as we can to deal with it.
O'Connor says when it comes to COVID-19 variants, this is important for many reasons. One, because it helps in perfecting diagnostic testing of the virus, so we know who has it. Two, it helps doctors fine-tune therapeutics and interventions for treating patients who are sick. And three, it helps scientists develop vaccines that elicit immune responses from the body to fight the virus.
All states in the U.S. are able to do the whole genome sequencing that's necessary to detect novel variants on a rather small minority.
State health officials say we are sequencing anywhere from 1% to 5% of the positive COVID-19 cases in Wisconsin. In Madison, where they are on the high end of that at 5%, they've got a good handle on what variants are out there. But in other parts of the state where the sequencing is less, it's harder to know. What they do believe is based on cases of the UK and South African variants in other states, it's spreading without travel to those places.
A substantial number of them have not had international travel. So that is evidence that there is community spread of these novel variants.
The lab at UW-Madison estimates that there is one mutation of the virus for every 2 new people infected, which means we will likely continue to see more different strains of COVID in the future.
I think there are combinations of these different mutations that come together to make different virus isolates around the world.
The sequencing of COVID-19 in the Madison lab goes all the way back to the first case 1 year ago in the capital city. The Milwaukee Health Department lab also does sequencing for the virus. Reporting in Milwaukee, Tom Durian, TMJ4 News.